65% of practices have intraoral scanners in their offices now, which is just like doubled from 2 years ago. And the reason why is because, of course, they're very, very convenient. You can do so much with them. You can diagnose, you can record keep. They're incredible for patient treatment acceptance because patients can see what you're looking at without, like mirrors or cameras in their mouths. And you can directly outsource things from your intraoral scanner, right? Aligners, smile design, perio trays, guides, occlusal guards. But you can now also directly produce things in your office by milling and 3D printing. And a lot of those things that I used to outsource, we are now printing in our office and doing it very quickly. Even when I was putting this slide together, I was like, this sounds like a lot, but it's very straightforward. It's very easy to do. And I think it's the easiest uptake of any technology we've ever done in our office was adding a printer and using a printer because we can do so much with it. And my team just loves it. So on the left is the actual printer itself. The middle is the wash station. And there's two components to this wash station. It's an alcohol wash station. One of them is for intraoral devices and one is for like models, things that don't go in the mouth. And then we have that little Curie oven next to it. New school, right? Digitally, we design it. You can either get software and design that yourself in your office, or you can outsource that, have it designed. It comes back to you as an STL file. You put it on your printer software, add the supports to it, and bam, hit the button, press print, and it's prints in about, probably takes about 35 minutes to print that. And once you've printed, it's pretty simple to go from print to the mouth. Very little polishing or finishing work. You just break off those supports, and we usually do it with our fingers actually because they're really easy to break off. So you break the guard off of the supports and then take a felt wheel and just get rid of those little nubs where the supports were and polish it, and it fits beautifully. They work really well. They're super fast, and anyone loses a guard, you have their digital representation of it and you just print them another one. So it's something that we're doing lots and lots of, and it's one of the ways, if you want to get started in printing, this is a great place to start, is printing your occlusal guard. You see it on the left side in its regular state, and that's just pinching it with very little pressure. They're super flexible and they're easy to wear. And many of our patients really like those. We make a lot of surgical guides in our office now too. I think it's important that for many people that once we diagnose them and they want to move forward with treatment, that we're able to get them in the surgical chair as quickly as possible. And frankly, in the chair for just about anything we do as quickly as possible. I do a lot of cosmetic work in my office, and the sooner people decide they want to do it, they kind of wanted to start yesterday. So with these guides, we're making just about all of our own guides now, and that's what our case is going to look at in a minute or two. Permanent restorations. It's like the next level of 3D printing. And for that, I use a product called Rodin Sculpture. And that's a ceramic nano hybrid. And this particular one is over 60% ceramic filler. It's radiopaque, it's glazable, it has great flexural strength. I've used this on a lot of bicuspids and teeth anterior to that. So I'm doing crowns, inlays, onlays with this. And sometimes people will say, well, I can mill an inlay in 15 minutes, which is absolutely true. You can mill an inlay onlay very quickly on a mill. But if you're doing it in a obsidian or a lithium disilicate, then it still needs to be glazed. And also with my mill, I can only do one at a time. With a printer, I can print many at a time. I can print 6 at a time or more. So when we're doing this kind of thing, sometimes it's same day for me, but oftentimes I'll prep a whole quad or I'll prep an arch of inlay onlay, and I will provisionalize overnight and have them back. We'll print them all, glaze them all, have them back the next day, and then insert them. It's printed on the left, just polished right there in the center, and glazed on the right. And on the right, it's I have it sitting on a mirror, so it looks like it's tube restorations, doesn't it? But that's the glazed, and you can really make them beautiful. And it's pretty fast to do these. I can print in about 7 or 8 minutes, wash, cure, polish. That takes me another like 10 minutes. And then glazing takes 5 minutes to get that on there. So the whole thing is like less than 30 minutes start to finish, which is really, really helpful. Because I've done so much cosmetic work, I have a lot of patients out there that are in, cases I've done for the last 25 years. And sometimes people will fracture something. And I used to take an impression and send it back to the lab and then have it made. See you later. You come back in 2.5 weeks after I get this back for you and wear this provisional. And now, boy, I scan it, design it, and make it in a half an hour and bond that in there. And patients are happy about that. And I'm happy about that too.